Hello, juniors. So thank you so much for coming. I believe you are required to come. So thank you for coming nonetheless. And welcome to the 7th Annual Griswold Center for Economic Policy Studies, JIW Research Forum. The purpose of this forum is we have two goals. One is to showcase what we judge to be among the top JPs from last year in anything related to policy studies. This is also a chance for the incoming juniors, beyond just honoring our current seniors, to get a sense of what types of papers they might write as a JP themselves. So this is meant to just show you 5 examples. You're going to talk to your JP advisors. You're going to find that like a broad variety of topics are considered, appropriate for your JP in economics. That's one of the nice things about economics, is that it's so broad. So these are just going to be 5 examples to maybe get you to start thinking about ideas of your own. Before handing it over to the presenters, I'd like to say a quick thank you to Kelly Noonan, Sylvia Weyerbrook, and Smita Brunemeyer for helping us put this program together and for all the work that they do for the undergraduate program. And as always, I'd like to thank Dana Molina, my executive director at the Griswold Center, for helping put the program together as well. So without further ado, let's get to the presenters. I'm going to introduce all of them right now in the order in which they will present their papers. So we're going to start with Karina Z. Karina's research looks at the impact of the Great Recession on private health insurance enrollment among middle and upper income households. And Karina's advisor was Henry Shim. Amy Liu will present her research on the effects of mid-sized bank regulation on risk profiles around regulatory thresholds, and her advisor was Nobu Kiyotaki. Oren Swagel will present third. His research examines the mental health effects of Supplemental Nutrition Assistance Program emergency allotment discontinuation. And Oren's advisor was Icicle Sahin. Grace Wang will present her research on the effects of the opioid epidemic on educational attainment, and her advisor was Zachary Bleemer. And finally, Annie Hsu will present her research that examines political uncertainty and options-implied risks using evidence from US federal elections, and her advisor was Moritz Lennel. All right, so we're gonna kick it off now with Karina.
Hi, everyone. I'm Karina, and today I'll be presenting on the 2008 global financial crisis and private health insurance enrollment. So to start things off, the first step in your JP process is just choosing a research question. And I'd say this is one of the more challenging parts of the JP process, so I'd recommend just starting to brainstorm early, think about what you're interested in, what you might want to explore. For me, I wanted to explore something that had adequate data but wasn't studied too extensively, and I'd previously taken health econ with Professor Noonan, so I was broadly interested in the impact of economic downturns on health insurance. And so I combined these into my research question, which is, what is the impact of the 2008 global financial crisis on private health insurance enrollment for middle income versus high income families? Previous research had limited focus on middle income versus high income families, and so I hypothesized that middle income health insurance enrollment was more negatively impacted than that of their high income counterparts. And then over the course of my research, as I'll get into, I addressed disparities between middle income and high income populations, as well as age heterogeneity and the impact of education. So for the basis of my research, I drew from 4 main papers, and I won't go too into depth on them, but all generally agreed that the Great Financial Crisis negatively impacted health insurance. And while the content of each of these papers was interesting in themselves, some were state-specific and others studied different outcome variables than I was interested in. So I kind of wanted to fill that gap in the research because there was limited prior research on both private health insurance in particular, as well as the differences between middle income and high income families in particular. So to answer your research question, you'll need to find data, and I'd say this is probably the other most challenging aspect of the JP. So again, I'd recommend starting early on that. Once you find good data, your life will be so much easier. But for my JP, I use the Survey of Income and Program Participation, or the SIP, which is a longitudinal survey conducted by the US Census Bureau. And once I had this data, I kind of needed to define what each of the terms in my research question meant so that I could run regressions on it. And so for the 2008 global financial crisis, I defined pre-crisis, crisis, and post-crisis periods. For private health insurance enrollment, I defined that as the ratio of those enrolled to the total population. And then for middle income and high income, I defined these groups using income to poverty ratios, which was a variable available in my data set. And this was based on the federal poverty line. And then, as you'll see in my regressions, I also controlled for age, gender, race, and education status. So the first model that I used for my research was a difference in difference model. And this used panel-level averages to estimate the baseline and the differential impacts of the global financial crisis. The equation I used is shown on the right. I won't go too into depth on it, but the key idea is just that I used interaction terms to measure the additional impact of the crisis on middle income relative to high income counterparts. And the second model that I used, in addition to my diff and diff, was an event study. And I used this to explore the unfolding impacts of the crisis by year, which went a little more in depth. And again, the equation I used is on the right. And again, this uses interaction terms to account for being middle income for each year. And as I mentioned earlier, I also wanted to explore age heterogeneity by exploring the differences in age on the impact of being middle income. So to do this, I divided my sample into 4 age groups, as I show on the right, based on just their general stages in life. And then I run first the event study and the diff and diff on the general populations to observe the impact of being middle income. And then for each age group separately, I run both regressions to observe how being middle income differs by age. So this slide shows you just my results for the difference in difference that I did. The top left shows the overall regression results, just highlighting that relative to the middle income group, the interaction terms show that relative to the high income group, the middle income group experienced additional decreases in health insurance coverage, both during and after the crisis. And then again, the bottom right shows the regressions by age, and kind of similarly, the key takeaway is just that middle income enrollment during and after the crisis decreased by more than that of high income peers. And similarly for my event study, this just goes a little bit more into detail than the diff and diff. And you'll see on the left here, there's parallel trends in the pre-crisis period. And then from 2008 to 2013, as well as from 2017 to 2020, the results were kind of what I would hypothesize, which is that middle income health insurance decreased by more than that of high income. But then from 2014 to 2016, there's kind of a result that you wouldn't expect, which is that the high income insurance decreased by more than middle income. And so I guess this kind of just goes to show you that sometimes your results won't be exactly what you expect, but they're important nonetheless, and you kind of just have to go with it and explain it the best you can. This slide is just the event study results that I did by age. Again, won't go too into depth on them, but the key takeaway here is that for each age group, the middle income health insurance enrollment decreased generally by more than that of high income peers, although the results are different based on age. And this slide shows the impact of education, which is not something that I initially had set out to explore, but by just controlling for education status as one of my control variables, I was able to reveal some interesting implications that education has on insurance coverage, specifically that increased education is generally associated with greater positive impacts on health insurance coverage, and that these positive impacts are generally most pronounced for the age 30 to 49 group. So to wrap things up, I used my research to identify a few policy implications, as well as a few limitations and areas for further research. So firstly, the main takeaway of my research is that middle-income groups are more vulnerable to economic shocks in terms of health insurance coverage than their high-income peers. And a likely reason for this, which I discussed in my paper, is that middle-income households probably make too much to qualify for public assistance, but they lack the same amount of safety net that high-income peers might have. And this points to a need for greater or more comprehensive protections or policies for middle-income families. But importantly, my research also finds that high-income households were in fact also impacted by the Great Recession, and this suggests that increased protections overall would benefit the general public, regardless of income status. And then finally, my research found that higher education levels generally correspond with greater rates of insurance coverage, which suggests that populations with lower education levels are disproportionately underinsured, and so this suggests that these populations could benefit from, targeted outreach or programs that improve accessibility to healthcare. And of course, given the scope of the JP, it's likely that you'll face some limitations in your research. And so for mine, one of my biggest limitations was that within the SIP data set, there were no geographic identifiers, so I wasn't able to account for variation in state-level policy throughout the observation period. And I think that this research also points to interesting areas for further research. For example, maybe disaggregating by state or exploring the impacts of other recessions, such as COVID, on health insurance coverage, which maybe one of you could do. So that's all I have for you, and thank you for listening.
Hey everyone, so good to be here. My name is Amy, and I will be presenting my research on the effects of regional bank deregulation on risk-taking around regulatory thresholds. And just to kind of break that down, basically what I'm looking at is a policy that took away regulation on banks and seeing if they take on more risk as a result. So to give some context and kind of explain how I got to this question, I knew from the start that I wanted to do a paper on policy, and I think one of the largest macroprudential questions we've had in the 21st century is what to do about the '08 global financial crisis. So I looked at the Dodd-Frank Act, which was really a paradigm shift in terms of regulating banks after so many failed in 2008. And then I also looked forward at more current events, such as the Panic of 2023, in which 3 major regional banks failed in rapid succession, and I was kind of wondering how we got to that point. And so I learned in my preliminary research about the Consumer Protection Act of 2018, which really rolled back Dodd-Frank era banking regulations. And at first I started with a very specific question. I wanted to look at a specific rule in particular, but I couldn't find data on it. And I think one big piece of advice I have is think about what's in the backyard of your interests. So I was really interested in the Volcker rule. I couldn't find data on it, and I kind of took a step back and thought, well, what else is kind of in this ballpark? And so I decided to kind of take a wider view lens and look at broadly the Consumer Protection Act as a whole. Essentially, just to get into a little bit of detail, the Consumer Protection Act provided relief to regional banks, and those were the banks that were kind of affected by the panic. And so my research question became, how did deregulation from the Consumer Protection Act impact risk-taking behavior in these banks at the new regulatory thresholds? In terms of context, so previous papers have really gone into the Dodd-Frank Act, have gone into 2008, and observed how banks behave when they are about to be regulated. There's also been research on whether the Consumer Protection Act should have been implemented, and so this is kind of a response to what has happened since. And also, there's been a lot of research on why the Panic of 2023 occurred, and that has kind of given us a new perspective in terms of banking risk. In terms of how this paper kind of added to existing literature, I tried to apply threshold analysis to new regulatory conditions, and I focused on risk-taking behavior in particular with variables that have recently kind of become really important to us, like interest rate risk. In terms of data, I would say my biggest piece of advice is to look for data that's really comprehensive, and I know that that can be really hard, and I think one good source is looking at what is federally regulated, because that usually requires a lot of disclosures on the behalf of businesses. So I took my data from the S&P Cap IQ database screener, and it essentially aggregates data found in call reports, which are federally mandated disclosures that regulated financial institutions must provide. My sample size was 77, and I kind of got the banks that were between the old regulatory cutoff, which is $50 billion, to the new regulatory cutoff, which is $250 billion in total assets, and then ones above that that have been continuously regulated throughout. It was a heavily right-skewed sample, so there are some interesting results because of that. and the large banks were extremely large compared to the rest of the sample, so I had to do a bit of additional data work to kind of regularize that and control for that. And then in terms of how I formatted my data set, I consolidated my data into a panel data set, so I was tracking changes in banks at the yearly level from 2015 to 2023. So in terms of independent and dependent variables, I was really interested in kind of asking the question of, do banks behave differently if they are mid-sized, like are they recently deregulated, and if they're in that post period? So I had a dummy variable to indicate whether each bank was below like the new regulatory threshold, so are they eligible for deregulation? And then I also had a dummy variable to show whether the year was after 2019, which is when the law was implemented. And then in terms of dependent variables, I think one of the hardest parts of the process for me personally was how to quantify risk, just because it's such a broad topic. And I decided to focus in on 4 main forms of risk to kind of cover my bases and provide a more illustrative picture of what was going on in this space. So I looked at liquidity risk, which I approximated as the concentration of core deposits, which are like a federally defined term for more stable deposits. I also looked at the risk of bank runs, which is typically what can trigger bank failures, by looking at the percentage of deposits that are uninsured. And then I also looked at interest rate risk, which isn't something that we've historically thought too much about in the banking regulation sphere. And that was defined for me as the number of positive risk indicators, which is a metric that regulators have created in something called canary reports. And then lastly, I looked at the more traditional form of risk that is regulated for banks, which is default risk, and that's kind of defined by the percentage of risk-weighted assets they had. And all of this was data that I found in the screener, and all of this was data that was made readily available. So I didn't really have to do too much work in that arena. And then in terms of methodology, so I did regression discontinuity design with two-way fixed effects. And to break that down, I'm really just interested in seeing, after 2019, is there a significant change in how banks are kind of performing in terms of risk? And also, is there a significant change for these mid-sized banks in particular? And then in terms of two-way fixed effects, different banks have different propensities for doing different things, especially because they sort of run business models separately. You have Silicon Valley Bank on one extreme end of the spectrum, which is very tech-focused. And so I controlled for banks specifically in terms of like their individual characteristics. And then I also controlled for time, because this time period encompassed some pretty interesting events like the COVID pandemic. And so that's what two-way fixed effects kind of means. It just controls for like time and also the individual characteristic. And then I also wanted to examine 2 forms of risk-taking. So I wanted to look at the raw form of risk-taking, like how much risk are they taking on that can be measured while controlling for growth rate. And so the model is here, and it looks complicated, but I promise, like, you just kind of, you have like nice Greek letters for the different model predictors, and it's really easy once you kind of get used to it. And then I also wanted to look at the variance of growth and risk, because there are dispersionary effects in the sample, so I didn't want to just look at the individual banks. I also wanted to look at the broader sample of like, what is everyone in this industry kind of doing? And so I examined the variance of growth and risk as well, which captures dispersionary effects, which are in essence, different banks might have different responses to the same regulation. So what is happening to the overall distribution? And then here are just some of the figures that I produced while I was analyzing everything. So the top 3 graphs are like raw levels of risk taking, and you can see that for certain things like core deposit ratio, which is liquidity risk, there's just more risk for mid-sized banks than larger banks. And then there are other aspects like interest rate, which just sharply shoot up across all categories. And risk-weighted assets declines over time, which is a really unexpected and interesting result that I'll get to in a sec. And then on the bottom, you can see the variance, which is kind of a proxy for how everyone in the space is moving. And you can see that over time, mid-sized and larger banks are sort of converging in that sense. In terms of results, so I didn't get any really crazy results, and that's totally fine. I think a lot of times the junior paper, it is more, and I'm sure a lot of people have said this to you, but it's more than fine to kind of get no significant results. You can still have a really interesting paper and still have a really good research question, and that's just a part of the research process, I think. Sometimes having these great questions and great hypotheses that don't pan out. For me, I had a small statistically significant uptick in liquidity risk for mid-sized banks, but overall the results that I got were not what I was expecting. So interest rates significantly increased for all banks over time, not just the mid-sized ones, and risk-weighted asset concentration declined over time, which suggests that all banks were taking on less risk in that department. And so I think for me the really interesting part was kind of trying to figure out why I was getting these results. In terms of discussion and overall, just to sum up everything, deregulatory effects for mid-sized banks exist, but they were limited in magnitude compared to what I expected, and interest rate risk persisted as an issue for all banks in this period. There are kind of 2 reasons for this. First, there's an increase in long-term asset reliance that kind of occurred after '08 and after regulation because large banks lost a lot of corporate lending to non-bank financial institutions. And the other aspect is just that interest rate risk has really been realized during the persistently high rates that we've had over the last couple years. And it's quite interesting because this isn't really a regulated aspect of banking. And so it kind of is interesting to see in real time these risks being realized and discourse kind of shifting away from some of the older aspects of risk that we were looking at. And then in terms of that surprising decline that I saw, it kind of suggests sort of along the same lines, a shift away from regulating risk and regulated risk going down towards less regulated interest rate risk. I think it's a common refrain in like the world of macroprudential policy that you can't ever eliminate risk from a system, but it kind of gets pushed around. And so this might be an introductory example of how that risk is getting pushed around. And then variance of risk-taking was converging between mid-sized and larger banks. In terms of chief limitations, there was really limited causal inference for me because there was a lack of a suitable control group and there was a pretty small sample size. And I also just wanted to reiterate, it is totally fine to not have a strong causal link. This is the point of the junior paper, is just to kind of get used to the research methods, like ask a good question and just kind of see what comes out of it. And you can still get really interesting illustrative results. So yeah, thank you so much.
Hi, everyone. I'm super happy to be here to present my paper, which was titled Unintended Consequences, the Mental Health Effects of Supplemental Nutrition Assistance Program Emergency Allotment Discontinuation. So I want to just start off with a high-level summary of my paper. And so it's important to understand for my paper, which was really a policy paper, the political context and the economic context in which the events that I write about took place. So in terms of the political context, when the pandemic first hit in March 2020, Congress passed multiple relief bills, one of which temporarily increased SNAP benefits through what they called at the time emergency allotments. However, those emergency allotments were conditioned on states which provide SNAP benefits having active state of emergencies due to the pandemic. In March 2021, states began to discontinue their COVID state of emergencies, meaning their EA programs were discontinued. In December 2022, Congress passed another law which discontinued all EA programs in the remaining states effective March 2023. In March 2023, the 32 states that had kept their EA programs were discontinued. So turning to the economic context of March 2023, as I'm sure you all remember, inflation was still quite high and the economy wasn't doing so well. So at that time, food insecurity was still above 10% of all households in 2023, and food inflation was still at 8% in March 2023, even though it was on its way down. And for low-income Americans, including those receiving SNAP benefits, food inflation that high is a really big deal because low-income Americans spend a higher proportion of their overall budget on essentials like food as compared to higher-income individuals. So my research question was, how did that March 2023 discontinuation of SNAP emergency allotments affect the mental health of SNAP recipients? And it's important that I specify that March 2023 date because in my research design, I exploit the fact that some states had ended their EA programs prior to March 2023. And as you can imagine is logical, given the bleak economic conditions and kind of just what seems reasonable given that you're taking away people's food benefits, I had expected to find a significant negative mental health effect. So when doing this kind of policy-based research, it's really imperative that you understand the policy and its mechanics, because you're not going to be able to understand and analyze how policy changes affect the public if you don't understand how the policy works. So at the same time, you don't need to be the world's expert in whatever policy, you just need to understand it enough. Don't waste your time reading everything there is about it. So turning to my policy of interest, which was the Supplemental Nutrition Assistance Program, SNAP, or what used to be called food stamps, which is the largest federal nutrition assistance program. As you can see in the chart, it takes up over 70% of federal nutrition assistance program spending. So in just fiscal year 2023, SNAP had an average of about 42.1 million participants per month, and it cost about $112.8 billion. Just to give you guys better perspective and context about that number, 42.1 million, that's more people receiving SNAP in the entire United States than live in Canada, which has about 40 million residents. The long story short is that SNAP is a huge deal. And if you're interested in SNAP or nutrition policy, I recommend looking in the news about the changes to SNAP that resulted from the recent One Big Beautiful Bill and other changes at state levels that are prohibiting the use of SNAP to purchase soda, chips, and kind of other junk food. So another important thing about SNAP, sorry, it's hard to see the keyboard down here. Another important thing about SNAP is that it's funded by the federal government, but it's administered by the states, meaning states are the ones who actually provide benefits. And that's going to, again, be important in my research design when I'm able to exploit that heterogeneity. And in the chart up on the screen here, I just want you to see how at that beginning in March 2020, you see that jump in SNAP benefits, and then in fiscal year 2023 in March, you see the drop again as programs, as benefits are discontinued. So as I'm sure you all remember from writing seminar, and as the other presenters have said, it's important to situate yourself in the existing literature. And while my paper was motivated by a bunch of research, which you can see up on the screen, the most important aspect of my paper with regards to literature was that there was an existing paper that I was going to be adding on to. Kind of a weird thing about this was that I had initially thought my paper was going to be the only research to look at this mental health effect. And unfortunately, in February or March of this past year of my junior spring, I came across this paper by Wells et al., which, although it was focused on the food insufficiency effects of discontinuing SNAP emergency allotments, it also studied mental health as a secondary outcome. And you'll notice I have December there just to highlight how coming in, I didn't know that there was something else, but sometimes things happen and you have to pivot in the middle. And so Wells et al., they found that although there wasn't a broad mental health effect, there was a statistically significant increase in anxiety for Black SNAP recipients as compared to white SNAP recipients. And my research extended their research in multiple ways, including using broader data and a different outcome variable. And what I really want to emphasize here is that extending existing research doesn't need to be super complicated. It doesn't need to be groundbreaking. There just needs to be some reason or intellectual backing for what you do is adding to the research and to the literature. So just think about what you're contributing. When I approached my data and my methodology, I knew that there were going to be two main challenges that I was going to have to confront. The first is that it's difficult to measure the effect of public programs on outcomes like mental health. The second was that mental health was changing rapidly during the pandemic, as it probably actually always is. And so while the solutions that you see up there didn't solve all my problems, and I'm going to discuss my limitations next, they did help me get a more robust methodology and analysis. So the first solution that I had was that I used high-frequency data from the Census Bureau's Household Pulse Survey to capture rapid changes in mental health that may have occurred. I highly recommend the Household Pulse Survey as a data source. It has really interesting questions, and they updated the questions and changed them based on what was going on kind of in the country. The second solution I had, which was to measure mental health outcomes, was to construct an index of mental health from the Household Pulse Survey's 4 questions about mental health, which related to depression, anxiety, lack of interest, and worry, which those 4 questions together made up the PHQ-4, or the Patient Health Questionnaire 4, which has been shown to be a validated predictor of mental health outcomes. And then to make my results easier to interpret, I standardized the index and put those coefficients in my regression equations, which you see on the bottom, in terms of standard deviations. Third, to measure the effect of EA discontinuation on mental health, I exploited that fact that some states had ended their EA programs previously to run difference in difference and then difference in difference in differences models, which again you see at the bottom. And then the fourth solution that I had was I figured that SNAP EA discontinuation was going to have differential effects across SNAP recipients in different financial situations. So I ran a heterogeneity analyses that were focused on groups of SNAP recipients who were already budget constrained and then were likely going to face even more hardship from the decrease of benefits at a time of high inflation. Fifth, to account for potential false positive benefit receipt reporting, which is what happens when individuals say they receive benefits but in fact don't receive benefits, I utilized 2 different methods of defining SNAP recipients in my data. One in which I simply took respondents' self-identification as given. If they said they received SNAP benefits, I wrote that they did. And the second was I combined self-identification with an imputation of eligibility, which means I took people's reported income and household size and compared that to the rules that their states had for SNAP eligibility. And only if someone both self-identified as and was imputed as eligible for SNAP did I define them as a SNAP recipient. And again, as I said, my methodology was I used difference and difference and then triple differences, both with and without state fixed effects. So before I go into my results, I want to detail some of those limitations because it's going to be really important, as everyone else has already said, to recognize that there's always going to be limitations to your work. The goal of the research process and your methodology is to just try and address those as best as you can. So the broadest limitation that I faced was that the household pulse survey was experimental and, quote, may not meet some of the Census Bureau's statistical quality standards. In this case, there was unfortunately nothing I could really do besides acknowledge that there's potential for bias in my data, and sometimes that's just how it's going to be. The second limitation that I faced was that the household pulse survey was not a representative sample. It wasn't representative of the US population, meaning my results would have lacked any external validity beyond the sample itself. Thankfully, the household pulse survey provided me with weights with which I could weight my results to make them representative of the US population. Third, and I mentioned this before, so I'm not going to dwell on it, there was that potential false positive benefit receipt reporting, and there could have been issues there. And then the fourth limitation is that imputation of eligibility that I mentioned could have itself introduced biases because it wasn't exactly correct given that household pulse survey respondents didn't provide their exact incomes. I only knew a range, and I had to make judgment calls about what I wanted to define as people's incomes. So I now want to turn to my primary results, which is looking at full samples of SNAP recipients and then all household pulse survey respondents. So to make a long story short, my primary results, which consisted of 4 regressions for each of my 2 samples, showed no statistically significant mental health effects. Something interesting that I want to point out, which you can see in the chart on the screen, is that for those highlighted coefficients, I know it says negative, but that would actually show that if those coefficients were true, discontinuing SNAP EAs, meaning taking away people's food stamps, actually made their mental health better, which doesn't really make sense just logically, but none of those coefficients are statistically significant, and there were lots of limitations in my data, so no conclusions can really be drawn there. So there's 3 reasons that I kind of believe might have contributed to this null finding, and the first of which comes from that Wells et al. Paper that I mentioned, just so that it's clear. So first, it's possible that there's a lag in mental health effects. It takes longer for economic things to filter into people's mental health, and I only used 6 months of data after EA discontinuation, so I just might have needed more data. Second, SNAP EAs had been explicitly billed as temporary. Other states, by March 2023, had already started ending their programs, and then that law that discontinued EAs was passed in December 2022, and all of those things meant that SNAP recipients might have priced in the effect that decreased benefits were going to have on their mental health, meaning that given my research design, using that March 2023 date as my treatment date, my methodology just wouldn't have picked up those priced-in effects. And then the third reason, which I find really interesting because it implicates other policies as well, is that Americans in the bottom half of the income distribution had, per research from the Federal Reserve, an average savings of about $5,000 from all of the stimulus that was given out throughout the pandemic. And so even though overall savings from all that stimulus was largely driven by high-income Americans, it's possible that the average SNAP recipient had enough of a cushion to cushion themselves against the effect of decreased benefits on their mental health. So now my heterogeneity analysis, as I said, it focused on 5 subgroups of SNAP recipients, which you can see up here, who were likely to already be budget constrained, meaning the reduction in benefits was going to be more harmful for them. To construct these groups, what I did was I thought about the resources that might have been common for SNAP recipients, and then I restricted my subgroups to those recipients who had access to as few of these resources as possible. And as potential resources, I thought about labor income and then other government benefit programs. I didn't think about wealth because SNAP rules limit how much wealth people can have. And the 5 groups that I ended up with were those who were unemployed, which meant that they faced the constraint of having no labor income. Those who were prime age and unemployed, which meant that in addition to not having labor income, they also weren't eligible for either Medicare or Social Security. 3 prime age unemployed SNAP recipients, and those people who, on top of no labor income and no benefits from Medicare or Social Security, people who didn't receive unemployment insurance benefits for whatever reason. And then my last 2 subgroups were that third subgroup split into those with children and those without children. And the idea there is that those with children face the additional constraint of having to support children, while those without children wouldn't qualify for some of these government benefit programs that are limited to people with children, for example, WIC or TANF. And again here, like my primary results, I generally found no significant mental health effects. I did, however, as you see up here on the screen, find a significant negative effect among the second and third subgroup, the prime age unemployed and the prime age unemployed with no unemployment insurance. But importantly here, I only found this effect when I defined SNAP benefit recipients by combining that self-identification with the imputation of eligibility. And then having seen that I found the effect among one sample but not the other, I realized I needed to go back to check and make sure that these samples, there wasn't something biasing these samples. So what I did was I went back to my data and I correlated demographics like race, marital status, sex, et cetera, with mental health to see what characteristics might have been most associated with poor mental health. I then ran t-tests to see whether these samples had similar characteristics of those characteristics. And what I found was that my second sample, the one in which I found these negative effects, actually had statistically significant higher levels of many of the characteristics that would have predisposed them to worse mental health in my data. So even though already it was hard to draw conclusions from my data, it was even harder now. And so just kind of the takeaway from here is no firm conclusions can be drawn, but it's important for policymakers when they see results like this to remember that benefit recipients, even especially those who are highly constrained, we're facing a tough economy with high inflation. And to think that when you're making policy changes to benefit programs, to think about those recipients who are constrained so that you don't unintentionally harm anyone in the process. And then just to go back over the overall findings, is there seems to have been no broad mental health effect from EA discontinuation. There does seem to have been some potential heterogeneity among some budget-constrained recipients. The limitations of my data methodology really dampen any conclusions that can be drawn from this. And then hopefully my paper motivates further study of the mental health dynamics of temporary increases in benefits during economic crises. And then just to give you all some general advice, which I hope can be helpful. The first is I highly recommend meeting with your TA regularly, even weekly. I met with my TA, Emily, basically every week. And it's going to help keep you progressing at a consistent pace. But even more importantly, it's going to make sure that when you do meet with your advisor, which it sometimes can be tough to schedule meetings with your advisor, that you're really focused on those higher level, more conceptual issues that your advisor's there to help you walk through. The second is that I really recommend keeping everything quite organized. I really wasn't very organized, and it made it really hard for me at the end when I had to go back and change a bunch of things. It meant I had to skim through Stata files that I didn't remember ever writing. The third is when you're reading your literature to try and think about other papers, I recommend using those papers' literature reviews as guidance. The fourth, and I think Professor Kuziemko and others said this, is that economics is really broad. You should think broadly. I knew I wanted to do policy research on mental health, and mental health is not something you typically consider in economics. So, it doesn't have to be something tangible like dollars. Really think broadly. And then the fifth is that things will always work out, but I really recommend using those intermediate deadlines to keep yourself on track, because otherwise the end can be pretty stressful. So thank you.
Hello, everyone. So Professor Noonan would like you all to check your iClicker, please. Check your iClicker for attendance, I assume. Okay. Okay, my name is Grace. I will be presenting on my junior paper titled Effects of Opioid Epidemic Exposure on Educational Attainment, and I was advised by Professor Bleemer. So the motivation for my JP is based in some work done by Ann Case and Angus Deaton, which highlights that increased pain and despair contributed to heightened demand for opioids, and this was particularly the case for Americans without a bachelor's degree. So I was interested in essentially looking at almost the converse of this claim, which is, does exposure to the opioid epidemic then also influence your educational outcomes? So my research question ended up being, does heightened exposure to the opioid epidemic affect the likelihood of graduating from college? So this is how I motivated my research question in my paper, but it does not necessarily reflect how I came up with it. I had initially intended on writing my paper in some topic in education. That has always been something that's interesting to me and a topic that I think is important to study. However, around this time last year, I had been doing some reading about the opioid crisis, so I had developed an interest in studying that, so I basically ended up combining these two interests in my research question. So what's particularly new about this paper? To my knowledge, this question had not previously been looked at causally. There have been some correlational studies that look at the connection between opioid exposure and test scores, for example, but no papers have been able to conclude what the causal effect of opioid exposure on education is. And another contribution of this paper is that I chose to focus on educational attainment instead of educational achievement, which is what those existing papers looked at. I made this choice purely because I think it is a more interesting and policy-relevant question. Grades and test scores can tell us some things about a person, but are not nearly as good predictors of future socioeconomic status as whether you have the opportunity to attain a bachelor's degree, for example. So in terms of data, what seemed most ideal to me to be able to address my research question was to have a data set of young people who I can then link on the most granular level possible to their level of exposure to the opiate epidemic. So I defined this as the number of opiate dosages dispensed in each person's commuting zone. So my young people are from the National Longitudinal Survey of Youth, or the NLSY. This survey begins in 1997 and tracks about 8,000 young people from their teenage years into their adult life. And in order for me to link these young people to their level of opiate exposure, I require their geographical location. And this is not something that's available in the public access version of the NLSY. So I ended up applying for access to a geocode supplement to the NLSY from the Bureau of Labor Statistics. And my opiate data is from the Drug Enforcement Administration. These are records that track Schedule II drug shipments. And I use various other forms of data as well to justify assumptions or perform robustness checks. For example, I also looked at opioid mortality data from the CDC, and I also required cancer mortality data to administer my identification strategy, which I will now discuss. So in order to get at causality, we need some kind of research design to eliminate the influence of confounding variables. For example, I could just run a regression of education on opioids, but that is not very informative because you can imagine that areas with higher levels of opiate exposure also have higher or lower levels of education. So those estimates will not be representative of a pure effect. So the research design that I use follows a recent working paper by Arteaga and Barone. This design leverages the fact that Purdue Pharma, who is the manufacturer of OxyContin, initially targeted cancer patients when they rolled out the drug in 1996. So this design assumes that those initial marketing efforts towards cancer patients resulted in increased take-up of OxyContin and other opioids in areas with high cancer incidence, which is correlated with having high cancer mortality rates. So this basically means that we can proxy for opiate exposure using the instrument of cancer mortality, which serves as an exogenous shifter. So through the channel of cancer to opioids, we can exogenously shift the quantity of opioids, which will help determine the causal effect of opioids on education. So no research design comes without assumptions, and I highly recommend understanding what the assumptions are in your research design and convincing yourself that they apply in your setting. So for example, in instrumental variables, one of the assumptions that is more challenging to justify is called exclusion. So this basically is reasonably intuitive. It basically says that when we shift cancer mortality, we want that to affect education only through the channel of opiate exposure. So if cancer affects some other variable that then affects education, then the estimate of the effect we are interested in will be biased because we'll be capturing other stuff that we created a whole identification strategy to avoid. So this assumption in my setting is a little hard to swallow because you can imagine there could be things that are correlated with cancer that are also correlated with both cancer and education. And here are some of these things. So the factors that I think pose the largest threat to exclusion and that I talk about most extensively in my paper are that of healthcare access and industry composition in your geographic region. So for example, if you live in an area with more hard labor jobs, then you could be both more likely to get cancer because of your exposure to that kind of work and also less likely to go to college. So what I did at this point in my JP was provide some empirical evidence to try to convince myself and anyone who is interested why these factors are not a threat to exclusion. So this involved doing some tests and making some figures. So a humbling thing about the JP is that you can work for an entire year and then realize you can summarize your entire project into one figure. So this is that figure for me. These are regression coefficients plotted with their 95% confidence intervals. Basically, what I take from this figure is that higher opioid exposure most likely results in poorer education outcomes. It is worth noting that previous presenters have already said that it is totally okay if your results are not significant. As you can see, these confidence intervals mostly cross zero, which means they are not significant. But that is totally okay. Insignificant results still teach us something about the world. Like I learned from this figure that most likely being exposed to opioids does not mean more college. And this is by no means a groundbreaking result, but is still interesting from a policy perspective. So your JP really does not need to have significant results to still be interesting. Like Oren, I also have an advice section. So I already talked a little bit about the first bullet point, which is to understand your setting and think critically about your assumptions. I sincerely hope all of you will pick topics that are genuinely interesting to you and you will feel motivated to read about your topic in the economics literature. I also urge you to read outside of the economics literature into journalism and other general interest readings. That will just keep you motivated on your topic and also allow you to conduct your analysis with more care. For example, when I was deep into the spring semester and feeling a little disillusioned with my JP, I reacquainted myself with the literature, did some more reading, and then at that point I was motivated to estimate the characteristics of the commuting zones in my sample that actually responded to produce pharma's marketing towards cancer patients. This is known as the complier sample and instrumental variables, and I learned some limitations of my research design through doing that, namely that the commuting zones represented in my sample are more those with more doctors and less so the commuting zones that have higher rates of non-cancer related despair. So I thought that was interesting. Another piece of advice I have is to visualize your data. I don't know about you, but I personally learn a lot more from the map than from the table. And it took me a really long time to make the map because I thought it sounded really hard to do. But then one day I finally sat down and looked up how to do it and realized it was not very hard. So definitely visualize your data, it's very useful. And this has already been mentioned, but discuss limitations of your work. I realize it's kind of counterintuitive when you're writing a paper to also be writing a paper where you're trying to like convince the reader that you are correct to also be discussing limitations. But the truth is there are a lot of things that I could have done paper. The limitations section of my paper was pretty long, and that will always be the case. There are always things you can do better. And being able to articulate those things will only be an asset to your JP. Finally, as you are starting to think about your JP topic, I think it's useful to think about your paper in terms of the trifecta, which is you need a question, data, and research design. These are all things that you need to have in your JP for it to be a JP. And again, I think it's useful to keep these things in mind when you're reading the literature and thinking about what you want to write about. For example, you might come across a paper that has a really interesting question, a really interesting design, but say their data is really old and you know of better data you can use. So you can work on extending that paper, or maybe you first come across a really interesting data set, and after poking through it a little bit, you come across a question that is interesting to you. So I definitely think this is a helpful framework to keep in mind. And finally, go to the Writing Center. It's extremely useful. I cannot emphasize enough the value of being able to talk through your ideas with someone and ensure that you are able to articulate them and that it makes sense to other people. And because you all are now working on independent work, you can make a Research Writing Center conference, which are one-on-one meetings with graduate students with extensive experience doing research. That is all I have. Thank you so much for your time.
Hi everyone, very glad to be here. I'm Annie, happy to present to you my JP on political uncertainty and options and applied risks using evidence from US elections. I was advised by Professor Morris Lunnell. So some very quick background and also motivation. Looking back to 2024, fun fact, it was actually one of the largest global election years in history, with around 60 countries going through an election, and of course domestic as well. We in the US have the relatively pivotal race between Harris and Trump. And if we look at this Bloomberg chart right here, it is superimposed a price chart between the US dollar, the US 10-year treasury yields, and also the odds of a Trump win implied from political betting markets. And you can see that there is this very interesting and curious effect where there's almost this co-movement between these three seemingly different, on one hand, financial market, the prices, and also something else around the election. And this is just to illustrate a sort of a stylist fact that this uncertainty leading up to an election where investors are very much thinking about the potential policy moves, and these uncertainty move the market. And if you recall sitting here for Professor Yogel's Eco 362, you also understand that when there's a lot of uncertainty, investors would typically demand a price premium to invest in riskier assets such as equities, and it is this risk premium that I was interested in. And in a nutshell, I looked at the financial effects of US elections and uncertainties preceding the resolution of this election. In particular, asking the question of how does the election and the process of this election affect the pricing, and mainly interested in 3 different types of risks that investors worry about: price risk, tail risk, and also variance risk. And colloquially, it just basically means that after the election date, people are worried stock prices could drop, but this price drop could be extremely large, and also finally, the stock return volatility could rise. And further follow-up, very natural questions on heterogeneity is just asking, does higher political uncertainty, for example, when people don't really know who is going to win and what are the implied policy consequences, would these increase this risk premium? And I was faced with 2 major challenges. First, how to really distinguish and quantify these 3 risks, and also because as we see today as well with the Fed and the rate decision, there are many things that move the market, from the Fed policies to earnings costs, et cetera. How do I really isolate election effects aside from all of those other parallel but essentially orthogonal market-moving catalysts? And just a little bit on my process of determining this research question as well. I mentioned that I was only basically just looking at the financial effects of political uncertainty. And in my first semester, all I did was a permutation exercise. I looked at what are the potential sources of those uncertainty, which could be federal elections, it could be European elections, it could be debt ceiling crisis, et cetera. And what are some financial effects I could look at? On one hand, you could look at price movements of fixed income, FX, equities, or even, as I did, which was risk premium, or could look at asset returns as well. And I went through this permutation exercise and basically leaned on some precedents. And in this example was Pastor and Veronese's 2 papers, where they established the model and also some empirical exercise that I further improved in my research. And I would encourage you to do the same as well, to do this permutation exercise and see what might be the most actionable. And as I mentioned, I turned to equity index options to address these 2 challenges. The source was from Option Metrics, and I looked at all the elections, midterm and also presidential, from 1996 to 2022. And you could think of options as this financial instrument that lives on 2 dimensions. On one hand, you have the price. Options trade at a price, and also they strike at a price. And on the other hand, I also live on the time dimension. You trade at one time, and options expire at another time. And I use the price dimension to quantify those risks because you can interpret options also as a hedging instrument that gives this downside protection. And the premium you pay, and the option price you pay, is basically how much investors are willing to buy this insurance against these different risks in the financial markets. So a huge part of my methodology as well was to construct these 3 options implied risk metrics, which was implied volatility, risk reversal, and also variance risk premium to quantify these 3 risks. And secondly, which is also my contribution to this paper as well, was that I took advantage of a very new and also more granular SPX option expiration schedule over the past decade, where we're seeing a lot of new and very liquid, shorter maturity options. And using that, I designed this higher frequency method to allow myself to really constrain my treatment into just a very short period around an election. What I did was I was interested in options that span an election, which in some sense they provide us insurance against these price risks within the markets, and also options that have maturities adjacent to the event but do not necessarily cover the event to serve as this natural counterfactual as the control group. And my methodology was mainly event studies. Simple regression. Here is a simplified version of this where treat is basically just an indicator function to show whether an option span an event or not. And the treat function captures the difference between these risk metrics for options that span event versus these that do not. I was also interested in some heterogeneity, so I interacted with an event indicator to look at how risks were priced differently across different events, and also some other potential covariates, such as, for example, how uncertain a election is, i.e. how close an election is, to see whether perhaps a closer election would drive a higher pricing or cost of disinsurance against those risks. The hypothesis here is that the tau, which is the coefficient of interest, would be positive because the options that span event, they provide disinsurance versus the control ones. Some quick results. This is a partial result for the event heterogeneity regression, where I was looking at on a horizontal axis, you have different years that correspond to elections, and on the y-axis is the treatment effect on implied volatility. We could see that in general, across every single year, there is a positive treatment effect aligned with hypotheses that investors are indeed willing to pay this cost of insurance. And interestingly, also very pronounced price premiums in 2008 and 2020, because another hypothesis is that there are a lot of financial distress occurring at the same time of those elections, which lead to the second interaction effect regression, where I was interested in seeing perhaps, first of all, how do economic outlook and how do closeness of race affect this treatment effect. And this graph, again, is showing the Z with a closeness of race, where I took advantage of a lot of political betting market data. And on the horizontal axis, again, we see election uncertainty. So the more uncertain it is, IV indeed increases across the horizontal axes. And also, if we look at the two fitted lines, you see sort of a wedge being driven between these lines, essentially signaling that there is indeed a heterogeneity in the treatment effect when political uncertainty rises. Okay, I don't think this is mine, but to conclude, it is indeed that political uncertainty, those from elections are priced within the equity markets. Some just interesting stats for you to look at. I found that generally those options that span election versus the adjacent ones that do not are around 22% more expensive in terms of IV and 33% more expensive in terms of the tail risk, i.e. like stock price might drop a lot. And the variance risk premium side, it is relatively the weakest result, but again, there was a shift from negative premium to positive between the control and treatment effects. And in the heterogeneity side, also aligned with hypotheses, relatively more significant elections, such as presidential elections, would drive a larger premium, while also those closer, more uncertain elections would drive the larger premium. And I think just to conclude the talk, some final advice. If it provides any consolation to all of you guys, all 5 of us are pretty much going through the same process of not knowing, and uncertainty, of course, on what we're going to do for a senior thesis as well. So it is perfectly normal, but I also want to say that this uncertainty could sometimes be paralyzing, but try to leverage this unknowing, and perhaps when you look at different papers, even if you don't know your topic, put it into your lit review. It will still ultimately contribute somewhat to your perspectives. And I think the second point is that even though you hear all of those presentations and all of these cool ideas, a lot of work could go behind those projects as well. Especially, I think a quick example is just to say, when you look at the data, there's actually so much of the details. For example, how do you standardize the data? Do you drop the outliers, et cetera, that you need to think through. So of course, give your time to celebrate those little, perhaps not so significant successes as well as you work through your project. And thank you.
So just generally, if you look, I think everyone here used pre-existing data or data that wasn't too hard to gather. So don't spend, a lot of times I see a lot of juniors trying to find their own data somewhere. You don't want to spend your whole semester doing that to find out you can't even put it together. And there's a lot of pre-existing data sets that are so good that haven't been used, or you can use it for a different question. So really try to do that. Some of the questions here were so good. I love the policy stuff. I think I've said this before, not just because it was about SNAP, and I like that, but thinking about a policy you're interested in is a really cool, easy way to kind of get started on a JP too, all right? If you guys need anything, you know where to find me.
Well, we've talked to you. We have the workshops coming up, but again, if you don't have data, you don't know what to use, please contact myself, Mary, Sharisa. Appointments at the moment are rather difficult because it's not just you, it's the seniors, it's everybody else, but just email us. And we can say whether or not we think it's feasible and at least get you things to get started. But the important thing is to get started.
At mental health, and you found it late in the game, but did they find any effects when they looked at that?
So they found no effects kind of broadly. They did a similar exercise as I did, and they actually used the same data just to answer a different primary question. They did find that there was a significant increase in anxiety among Black SNAP recipients compared to white SNAP recipients, so there was an effect. Their paper was subject to a lot of the same limitations that mine was in terms of kind of the data, and they imputed eligibility. They disregarded what people said, and I think that introduced a lot of problems. But yeah.
Why would people not be honest about receiving SNAP benefits? I'm just curious.
So something I didn't mention when I was presenting is that most kind of wrong answers on surveys are actually the opposite direction from what I talked about. Most of them are false negatives, and often people feel a stigma about reporting that they received government benefits. People feel stigmatized by getting welfare or getting something from the government. Just kind of people feel bad about it. But I couldn't really figure out a good way to control for that given the data that I had. And the research that I found about it did show that some people do false positively report just because people make mistakes or they confuse SNAP with some other program or they hit yes when they mean no. So I tried my best, and it's another good example of sometimes you're going to try your best and leave it there.
Thanks. I think it's great. I just, did you run into in your research anything about people that qualify for SNAP but don't get it because of the stigma thing or because they don't know about it? Or just curious.
It wasn't, given the data that I had, it wasn't so, I didn't really think about it as much, just given what I had. I think the way that it kind of ties in is into that limitation of how imputing the eligibility could have itself introduced in sort of inconsistencies that even though I was imputing who was eligible, just because you're eligible for something doesn't mean you get something, you get some benefit. And I know just from recently, there's been a lot of talk about kind of administrative burdens, and people face a lot of burdens oftentimes for getting on benefit programs. So, yeah.
It's just a comment. He used the word experimental. So one thing that's really important is while you're focusing on data, more important than the data is the documentation. So most of our presenters today talked about you've got to understand what you're studying. The Census Bureau, the Bureau of Labor Statistics, these have always been viewed as gold standards. So the Census Bureau, even though they did this pulse survey during COVID, it is incredibly rare that they add a new survey. Everything is so carefully weighted. It's so supposed to. They needed data quickly. So it's good data. It's just it was not weighted the way their other things are. And as Oren said, you can't do anything about it. but you do need to note that and what the limitations are. So when you're looking at your data, don't just focus on the numbers, focus on why it was done, focus on the reasons, focus on who's there, who's not there. So all of those things you want to look at.
Thank you all for such great presentations. I was just wondering if you could share a little bit more about how you went about determining the right methodology for your paper, who you talked to, how you got there.
I think in terms of methodology, that's where your advisor and TA can be really invaluable resources because, I mean, as you saw with all of our presentations, there are so many different ways to answer a question. A lot of times you'll end up doing, you know, some variant of a regression, but there are also other ways to go about it. And what was really helpful for me was kind of taking what I was trying to see the effects of and also thinking about what I was interested in. So for me, that was like specific policies related to banks and then bank actions as a result, and then just going to my advisor and kind of asking, like, this is the data I have. I was maybe thinking of like these two things. What do you think would work better? And that's how I got to like regression discontinuity design. And my advisor was like, maybe you should add two-way fixed effects. So I think that's really like a ongoing conversation that you have with the advisors and the team around you. And I think that's probably one of the most helpful things that they can offer you in your advising journey.
Yeah, I mean, I would I would echo what Amy said. And again, I would just emphasize that I think depending on what your research question is, I think that can kind of really help shape what your design is. So for example, for me, I was looking at the 2008 global financial crisis, which was like an event in time, and I was looking at like the results across time. So it made sense for me to do an event study, for example. And I think one other point that I would add is it's really helpful to look at what the other papers in your literature study, the different methods that those papers have used, because I think especially if you're looking into something similar, the methodologies will probably be something around what your other papers did.
Yeah, I just want to echo what has already been said. I think looking in the literature is super helpful, is looking at what other folks have done with your research question, what designs exist out there. Economics is pretty much about finding causality, and you will find that it's necessary to have something kind of weird in the world for you to be able to answer your question with some kind of to have it be causally identifiable. So weird things such as like policy cutoffs, or like what Oren did with like policies being like rolled out at like differential times with like heterogeneity. These are all things that are very useful to get kind of some variation in your data so you can estimate an effect. So definitely read in the literature, but also what I said in my presentation, to read outside of the literature so you can see if you can find a design that no one has looked at before even.
Just a slightly different approach and perspective from my end. My methodology was mainly dependent upon a new data that I found to be interesting, which in my case was that there are new higher frequency options data. So from there, it is also an approach that you could try to explore, seeing what kinds of data are out there and perhaps what people have done about it.
Okay, so thank you so much for coming. I wish you all the best for your junior papers. I hope that it's a rewarding experience, no matter which topic you investigate, and that you learn methodologies that will help you throughout your careers. So good luck and enjoy your junior year.